I'm also a sister, a daughter, a wife, a mother, a grandmother. And throughout my decade by decade by decade, I've sort of been, I call myself a head and a heart on a stick, where I've just been powering through my life and just hoping that my body was following suit. In the decade between 60 and 70, I began to realize that endurance alone wasn't going to do it. And I had the honor of coaching Ricki in her decade game, but it turned out she was actually coaching me too around how do you make sure that you really are equipped? How do I make sure that every decade can be the best decade of my life so far? And Ricki gave me some great advice. And it was like, why did it take me so long to understand what was really happening in my body? So I'm now 3 months shy of my 70th birthday. I'm in the middle of beginning to create my 70 to 80 decade. And I've never felt better. I've never been in better physical shape, mental shape, emotional shape. And as I think about the last couple of years, where it's certainly been a challenge for all of us for all sorts of different reasons, I've been able to navigate all of that in sound mind, body, and soul. And I credit Ricki for a lot of that, what she wants to do, which is to be able to democratize what she knows, because the medical profession hasn't really focused on us the way they should. And I know that Ricki is going to spend the rest of her life making sure that women know what she knows, the latest research, et cetera, so that all of you can look forward to the best decade of your life so far, no matter how hard it might be.
This is the olden days. This is that kind of neat graphic I found. And it just sort of shows the life cycle, which is sort of fun. So, a little baby, and then there's a little girl playing with her doll. And here's the young ingenue just getting ready to be married. And maybe she'd be about 17 at her wedding. And then by 18, she's got her first baby. And now once you face reproduction, you're either going to be pregnant, nursing, or if you had a bad outcome with that last pregnancy, dead. And so most women did not live beyond reproductive years. The few that did, and you can see the osteoporosis creeping in here at age 70, and by 80, and again, we have a beautiful example in Ruth Bader Ginsburg. We all loved her and remember her wisdom, but look at her body habitus, especially her neck. That was osteoporosis in a brilliant, incredible human being. So that's not the life you and I would like to live. Here's another just super simple, but absolutely elegant picture. And the picture is the lifespan of hormones from birth to 83 years of age. And just to think for a moment, sort of contemplate the profundity of we're born, we have a bump in hormones because we got them through the placenta, through the umbilical cord from mom. Then they go back down. And then once we adolesce, I'll first do men because men are simpler. So what happens with men is they reach their peak testosterone, usually about age 20, not surprising for women who have been mothers to boys. Then if you look at this line, this blue line of testosterone, it really sags very little. And again, that last point at the far right is age 83. Women have a very different road to hoe. Here's our adequate estrogen, and then we get to about age 45 as a group. Individually, this varies. Some women have a little earlier menopause, others a little later, but as a group, our estrogen level falls and it never recovers. What is also huge on this slide is this quiet little blue stripe down here. This is the actual level of estradiol in men through age 83. So what does that mean? What that means to me is men do not develop osteoporosis because this beautiful little bit of estradiol that they make their whole life, unless they do not have testicles, PS, that little bit of estradiol protects them from bone loss. But estrogen, and I use the general term because in fact, Premarin, the one from horses, also prevents heart disease. But we've done head-to-head showing that bioidentical estradiol and Premarin both prevent heart disease. They both prevent bone loss too. So the mechanisms there are elegant. They're super well worked out. They also, this surprises women all the time, you actually accumulate less belly fat when your estradiol level is adequate. Most importantly, I think, from my perspective, because it's the more urgent, early change that can create neuron damage and cognitive decline, poor sleep, insomnia, memory loss, brain fog, even depression, often very related to estradiol insufficiency in the brain. But estrogen, of course, also prevents vaginal dryness and pain with intercourse, prevents dry eye. Anybody on this webinar whose eyes are dry, that may well be related to insufficient levels of estrogen. And I just can't emphasize the next point. Estrogen does not cause breast cancer at any age. We now have, say, 30 years of life without that natural healthy balance that keeps you vigorous. And so we're between a rock and a hard place because estrogen deficiency accelerates aging. And you need to look no further than any man who's about your age and look at his skin on his chin and his neck versus yours. It's quite apparent that men's skin does not age the way women do. And even when they're pretty old, they still have a lot more sub-Q in their hands. These are brutal biologic truths. And you see this in your mother, your grandmother. We all know this may be coming, this thin skin in my hands thing, but there's a reason for that. And I think it's just really important to see that we are made up of billions of individual cells, and every function inside the cells is mostly related to and dependent upon estradiol. We know absolutely beyond the shadow of a doubt that estrogen deficiency accelerates heart disease, increases your risk of diabetes, increases the rate at which you lose collagen. That's in your pelvic floor. A lot of the problems with urine control have to do with loss of not just muscle around the neck of the bladder, but also loss of sort of the connective tissue sling. The blood pressure goes up oftentimes because your arteries are stiffer in the absence of estrogen. We know all these mechanisms. Okay, so why is our medical culture so anti-estrogen? Why do so many women think, because doctors think, that it's going to give you breast cancer? We know it gives you all these other bad things. Who's tallying up the increased risk of all these disorders with the minute risk? And what the risk really is uterine cancer if we don't take progesterone to offset the stimulatory effects of the uterine lining that estrogen causes. That is the only part of our natural bodies that is estrogen dose and cancer potentially related, not the breast, and certainly not the skin. Estrogen is the only thing that relieves about 95 to 99% of hot flashes and menopausal symptoms. So, makes sense. Like it was there before and I didn't have these symptoms and it's gone and now I do have these symptoms. So that is true. There's really nothing like your natural native estradiol. And that's really where I want to turn it over to questions and answers.
This is around taking hormones. when is the right time? And is there a time period where it becomes the wrong time? Again, either too early, too late, or you've done it too long, or you're not taking enough.
The answer I give at my continuing education talks, just because I am a little bit of a devil, I say, you know what? When men think they've had enough of those hormones that are just going to take their testicles off, that's when I think women should stop taking estrogen.